My name is Tiffani Maycock, and I am the program director of the Selma Family Medicine Residency Program. And I thought I'd share a little bit about my journey in community work, and then that way I can kind of give you some background about me and what kinds of things that I've done, and then some of the things that I've learned along this journey. And so when I was in residency, I really enjoyed being a part of the community and doing work in the community. And when I finished, I wanted to work in to do some community work. And I applied to some federally qualified health centers and things like that. But I didn't find that even though they were community health centers, they weren't really invested in doing a lot of community outreach the way I wanted. So I went to Huntsville and I did my OB fellowship for a year. And then after that, I joined the faculty. And then I found as a faculty member that I could take my love for the community and spread it amongst the residents. And then with the residents, I was able to do a lot more than I could do all by myself. And so that was very exciting. And so we did a lot of different things. I reorganized the community medicine rotation for the residents there in Huntsville. And so I coordinated a lot of health fairs. As you can see some pictures here, we kind of focused on the uninsured Hispanic population in Huntsville at the time. So we did a lot with that. And then we also, I also had the residents conduct needs assessment. So I had them each, when they were on their community medicine rotation, look at and identify a subset of the population and identify a need that subset had, and then to be able to, with that, come up with some kind of way to implement helping that population, and then doing that kind of thing. So that was neat. And so some of them actually came up with projects that they were actually able to do some poster presentations. So that's what you see here. And then we also did lots of other things. I started Reach Out and Read both in my residency program in Dayton, Ohio, as well as in Huntsville. We participated in lots of different health education lectures and things like that. And then moving on to Selma, we also I supported and helped many communities, helped organize lots of different health education seminars. We did lots of health fairs and we created a community chair, a leadership position in the residency itself to help serve as a liaison between the residency program and the community. And so all those things are very exciting. And so what are some traditional ways? So thinking more specifically about health disparities research, what are some traditional ways in which community engagement and research is conducted traditionally? You can unmute yourself and answer or put your answers in your chat. What are some traditional ways that when you think of research in a community, that things are done?
They're oftentimes just assessments on what's already being done, and then kind of basic reporting. It's almost like, here's the data. It's almost like descriptive data in a way.
It's descriptive. What else?
You elaborate on that? Windshield surveys are a common modality. You can assess community safety through those, and the poverty level, which may correspond to other comorbidities and health conditions.
Okay, so doing some external surveying of the community. That's good. And so some of the big things that when I think about traditional community engagement and research, you think of these big box research programs are going to come in, somebody has some big bright idea from far, far away, and they're going to come in and they're going to do they're going to sweep in and they're going to impose this program on this community that they think needs it. And they're going to have, health fairs, they're going to have people preaching at them. And then they're going to do their intervention, and then they're going to leave and you're never going to see them again. And so that has been kind of the tradition in in research and community engagement. And so it's kind of eroded some of their trust, especially in rural areas and especially in places where engaging minority patient populations. And so that trust has been kind of eroded. And so we need to find a better way. So thinking specifically about challenges in rural communities, what are some challenges that rural communities face? Unmute yourself and answer.
Transportation issues, geographical isolation.
Transportation, geographical isolation, what else? I'm sorry, Kim, we can't hear you.
Limited personnel with the need for a few people to wear many hats.
Access to resources.
Right, limited access to resources. You have to wear a whole lot of hats, doing a whole lot of different things. Health literacy and illiteracy. Great.
One of the things that we found out during this pandemic and needing to use telecommunication is a lot of the rural areas still don't have broadband internet. And trying to get your patients in on telemedicine kind of visits is just about impossible. Right, exactly. And then some of them, even if they might have a telephone, but they don't have a reliable telephone, they don't have a telephone that they the phone number that they give you, and one day might not work the next day. So things like that. So there's definitely technology issues, there's transportation issues, the literacy, there's access to like devices, like Dr. Kenser said, to be able to do the telehealth and that kind of thing. A lot of times they're food deserts. So there's a lot of different challenges that rural communities face. And so some of these challenges we talk about what we call social determinants of health. And so according to the World Health Organization, the circumstances in which people are born, they live, they grow up, they work, and age, and the systems put in place that deal with illness, those things affect their what we call social determinants of health. And so these circumstances are, in turn, shaped by a wider set of forces like economic forces, social policies and politics and things like that. So in rural areas that there's what we call rural social determinants of health. And so it's all those things that we talked about, because when you think about like the income level, the educational attainment, the race and ethnicity, the health literacy, all those things impact the ability of people to access health services and meet their basic needs, such as clean water and safe housing and things like that, which are essential to them staying healthy. And so rural residents are even more likely to experience some of these other contributing social factors that impact their health, such as poverty. And so the impact of these challenges can be compounded by the other barriers that you talked about in these rural areas, such as limited public transportation and limited technology and things like that. And so one of the things that we've been using. So we look at the traditional way we've done research and community engagement in the past, and we've looked at what some of these needs are. And so how can we bring those two things together? And so one of the ways that we can bring those two things together is by what we call community-based participatory research. And so what that is that community-based participatory research was developed in order to assess the needs of a particular community and then analyze the impact of those needs and develop and analyze interventions to meet those needs. And so, and this is something that we can really be utilized very well in rural settings as well. And so community-based participatory research is a partnership. It's a partnership approach to research that equitably
involves both the community members, it involves the practitioners and the academic researchers all together, working together in all aspects of that process to enable all the partners to contribute their expertise and share responsibility and share ownership. So it's a group, it's a partnership, it's a group activity. And so among the core principles of community-based participatory research is the commitment to build together the whole community with their strengths and resources, and then to foster co-learning, because there's things that the researchers need to learn from the practitioners, and they also need to learn from the community members. And so they all work together to for that mutual benefit of all the partners that kind of work together. And so that's the basis of community-based participatory research. And so there's that whole notion of power sharing and action, as well as research. And so all of that is put together in community-based participatory research. And so that is a really important when you're trying to address some of the, understandably, some of that understandable distrust, of academic research that exists among communities of color, and of, examining and addressing health disparities, in those communities that are involved. And so this is a very a unique way that we can work on meeting some of those needs in a balanced approach. And so when you can take the social determinants of health, and you can take when you can put them together with the academic research, and put those things together to have a stronger impact. So back to Selma. So I learned kind of like what you guys did when you're learning about what resources are available at your institutions. I think I came across an email or something. I learned about that UAB has a minority health and health disparities research center. And I thought, wow. Well, I live in, we have a lot of minorities here, and we have a lot of health disparities. So I could probably use, some of the things that are offered by the Minority Health and Health Disparities Research Center that they have at UAB. And so I learned that the Research Center generates and disseminates research knowledge from the biomedical and behavioral and social sciences in order to kind of reduce the health disparities experienced by these vulnerable populations and disadvantaged communities, both regionally and locally and nationally. And so when I was starting to learn more about them, I said, how about you come down to Selma and can kind of give us some, give us a breakdown of what your program does and what kind of things you do, so that we can start to learn what resources are available to us at UAB. And so we can start to work on that. Us being the practitioners can kind of collaborate with the researchers to see if we can meet some of the needs in the community. And so they came down and they described this program that they have, a project that they were working on, where it involved 5 communities in Alabama, and they're highlighted here in the picture, and they formed community coalitions. And one of them was in our county. Oroville is in our county. And so what they did was they went in and they formed a community coalition, and they found out what the needs of that community were. And then they tried to put together some of those needs with some of the resources that are available through different grants and things. And so those community partners, they came together, they sat down at the table together, they collaborated together to identify what those issues and barriers and challenges were, and to come up with some solutions. And so they asked the questions, what social determinants of health are barriers, what barriers to social determinants of health that we can address? And then what resources can we link with them to help address some of those needs? And so some of the things that the community decided, they're like, we don't have a safe place to walk and exercise. And so they developed a walking path there in Oroville. And so it's pretty nice. And they have these cute little signs and everything. The community also identified healthcare as a need. And so when the group shared with us that that's one of the needs that Oroville had identified, I thought, we have a free clinic that we run every week called Dockland Spot. And we used to be a mobile clinic. We used to go, we used to have a van that we used to travel around. And I thought, well, maybe instead, well, we kind of stopped doing the travel part. So maybe we can take our services to Orville. And so that's what we did. We decided to pack up our stuff, and we would take it to Orville once a month. And so that way, and that's what that picture is of us at our Orville clinic. And you see, it's a gym at a school, elementary school that was closed down. And so that's what we use once a month. And we take our partitions and we put them up, and we take care of patients there in that gym. Another thing that the Minority Health Disparities Research Center has is they have a Parks RX program, which is a nutrition model and an exercise plan, and they started implementing that in Orville as well. So there's been those collaborations. This is us at Dockland Spot in Orville when we first started. It was pretty exciting, and so we were able to take our help provide a need that was identified by the people of the community in conjunction with the academic institutions. So we all came together to be able to meet the need. And so that's what community-based participatory research is all about. Another program that we are in the process of working on is through our collaboration with Dockland Spot is an exercise prescription program. And so the staff at Dockland Spot recognize that we have a lot of patients that have diabetes and hypertension, and they weren't, that one of the things that they complained about was having a safe place where they could exercise. And so what we did was with our collaboration with the Ebonite Missions, who recently constructed this recreation center, that we plan to do, and in the process of working on, is having exercise prescriptions that we give our patients at Dockland Spot, that we can give them, and then that the staff at Dockland Spot and the staff at the Ebonite Missions can work together to help provide coaching and education and a safe place for our patients to exercise. So those are some things that we have done kind of practically in this vein of community-based participatory research, so that we can bring together the needs, the academic resources with the needs of the people in the community.